Ben and I make a podcast for WBUR called Endless Thread. And in 2019, we produced a series about vaccines and anti-vaxxers called Infectious. That series focused on the measles outbreak in the United States in early 2019, which really feels kind of like ancient history right now.
Right, but a lot of our reporting from back in 2019 has also felt, unfortunately, kind of shockingly relevant recently. So tonight's event is about ethical implications of the vaccine rollout. Questions like who gets the vaccine first, how we make those choices responsibly, efficiently, and ethically. For that part of the evening, we're going to hear our esteemed colleague, WBUR senior correspondent and host, Deborah Becker. She's going to interview Akilah Jefferson Shah, who is an assistant professor of allergy and immunology and also a bioethicist at Arkansas Children's Hospital. They'll be talking and taking your questions, so you can start putting them in right now to get ahead of the game at slido.com. Again, that's slido.com.
Before we get to that, Ben and I are going to present to you a different story about a kind of ethical crisis regarding information on vaccines. Anyone who's been searching on a loved one's behalf for a COVID vaccine appointment, which would be a lot of us, have spent a lot of time trying to get accurate information online. Personally, I've spent a lot of my last month frantically refreshing the vaccine appointment sign-up page for Virginia to help my wife's 92-year-old grandmother who lives alone schedule an appointment. The times I've been refreshing are midnight and 5 a.m., which is apparently when they update with new appointments. It is a horrible system. It's stressful just to schedule an appointment, not to mention finding reliable information about vaccines themselves. If you've ever searched for information online, you may have run into problems, not just websites failing or the scramble to find open appointments, but also just the existence of misinformation about vaccines. That stuff is all over the internet, and there are some places where it's easier to find than others, and one of those places is Facebook.
So back in 2019, the Endless Thread team looked very closely at misinformation on Facebook when we were reporting our infectious series. Our reporting was focused on how groups were reacting to the MMR vaccine, which is delivered to kids to protect them from measles, mumps, and rubella. But the closer we looked at misinformation on Facebook, the more we realized there's an entire ecosystem of groups pushing misinformation about vaccines more generally. It's an ecosystem that is now pushing misinformation about the vaccines being used to fight COVID as well. This kind of bad information has become, at its core, an ethical issue for social media and tech platforms that are signal boosting this misinformation. And that has had companies like Facebook, Twitter, and YouTube under a lot of pressure to help fix the problem.
So back in 2019, Endless Thread looked at this dynamic, and first we set out to try to understand how these groups work. And we had some help from people like Joan Donovan, the director of the Technology and Social Change Research Project at Harvard's Shorenstein Center. She studied how anti-vaccine groups find an audience on Facebook. One thing they can do is pay for advertising on the platform, but they can also find groups already primed for skeptical conversations about vaccines more generally. Here's Joan.
One of the techniques, if you're not using any pay-for advertising, is to just search out momversation groups. Look at all the places online, message boards, Facebook groups.
Sorry, did you say momversation?
Yes, I did say
Okay.
momversation.
Okay.
So these are groups where young parents will get together, share tips and tricks and, how do you make sure your baby goes to bed on time? How do you potty train? And those groups that are brought together for various reasons become places where parents do discuss the need for vaccines. And it's in these spaces that we see that they're presented with a range of alternatives, from products to outright refusal and how to refuse.
So these groups often connect not just on social media platforms themselves, they link out of Facebook, for instance, to other sources. And those sources have even more control over how they present information. We see this all the time. The audience for the misinformation exists on Facebook, for instance, but once you reach that audience, if you are trying to push bad information about vaccines, you try to get the audience off of Facebook and to following some of these other places.
We know that there are, pardon the use of the term fake news, but literally fake scientific news websites that look very organized. The articles are very well written, but they are not presenting scientific information.
So just to be super clear here, there are fake news websites. There are also fake science news websites. And these sites don't have an existing readership without the help of social media companies.
But a lot of the reading list starts in the Facebook groups themselves. And if you've ever joined a group on Facebook, I know I have, you know that Facebook groups can be public or they can be private. And one of the biggest private Facebook groups pushing bad vaccine information back in 2019 was called Stop Mandatory Vaccination. This group is run by a guy named Larry Cook. And Josh, I appreciate you. Josh bit the bullet and decided to join this group. I don't think his ads on Facebook have ever been the same, but we appreciate it.
I did join this group. The very first thing I noticed when I joined was that in the main banner image, there was a link for a whole suite of anti-vaxxer related products you can buy on Amazon. Things like sweatshirts with a skull and crossed needles instead of crossbones with the words anti-vaxxer, proud and healthy. And there were hundreds, sometimes thousands of posts every day in this group. A memorable one displayed a fake Time magazine cover, which really does look very convincing. It says toxic vaccines, sick kids, and incompetent leaders who betrayed them. This was a riff on a real Time magazine cover about the Flint water crisis. And the real cover said the poisoning of an American city, toxic water, sick kids, and the incompetent leaders who betrayed Flint. And so at a quick glance, you can really get a sense for how this type of misinformation can be extremely convincing. And one of my biggest takeaways from spending time in the group was that it's not just focused on vaccines. It's really about how being anti-vaxxer fits into a lifestyle, a healthy lifestyle. There were posts relating to eating healthy and exercise and rejecting other forms of quote unquote mainstream medicine. And I think that one of the reasons this is a strategy that these groups use is that because if people connect being an anti-vaxxer to a part of their identity rather than just to a single choice that they're making, they're more likely to stick around and maybe buy some of those products linked to on Amazon.
So again, you might be asking this question, sort of where do the ethics come into this discussion, right? And over time, this kind of group on Facebook has come to present a real ethical question for tech platforms, basically when to remove bad information and when to leave it up. Essentially their role in pushing this information. Places like Facebook and Twitter have resisted wading into this debate quite a bit, but they're being pushed more and more to do so. And according to researchers looking at this, that is with pretty good reason.
So when we were reporting this series, we wanted to go right to the source and talk to Facebook directly about the issue of vaccine misinformation, which Ben did when he interviewed Facebook's head of global policy development, Monica Bickert.
What made Facebook want to take a closer look at these groups that were pretty active on its platform?
Well, first, I want to clarify that what we're doing on Facebook is not about the anti-vax movement. What we're trying to do is stop the spread of misinformation, hoaxes that are about vaccines.
A lot of people would say that clearly a lot of the information being spread around in these groups is verifiably false. Full stop.
Some content that people share about vaccines is misinformation that's verifiably false. So where we see that sort of misinformation on Facebook, we are taking steps to combat it.
Back in 2019, those steps were really focused not around getting that bad information off of Facebook, but just making it harder to find, making sure that anti-vaxxer groups wouldn't surface first in any search results, making sure that when you're typing into the little search box on Facebook, it wouldn't autofill something that would lead you to an anti-vaxxer group or anti-vaccine misinformation. But Monica did say that they were stopping short of preventing people from sharing their own personal experiences. because that would be kind of against Facebook's policy goals and really its value for users at the time. But we still wanted to know if Facebook's representatives thought that the measles outbreaks in 2019 had anything to do with their policies. So once again, here's Facebook's head of global policy development, Monica Becker.
Do you feel like Facebook shares some of the blame for the outbreaks that have occurred?
We're certainly a place where people talk about vaccines, and we know that people have shared these hoaxes or misinformation on Facebook. But at the same time, we are doing a lot to make sure that we are educating people to make informed choices.
So is that a yes, no, maybe? What is that?
We're certainly a place where people come to talk about vaccines, and we know that people will, when they do that, sometimes share misinformation. We're continuing to work on this, and we're committed to getting it right.
So I'm going to call that a yes, but we're trying to fix it. Does that seem right to you?
Look, Facebook, what happens on Facebook mirrors what happens in the offline world. So just like people talk about this offline, they're going to talk about it online.
So you can really hear Monica kind of struggling there, right, with Facebook's ethical conundrum, being a venue for misinformation, but having mixed feelings about how to fix it. Well, in 2020, we got some updates to this ethical quandary. In some ways, the measles outbreaks in 2019 and Facebook's role in hosting misinformation around the MMR vaccines and vaccines more generally became a kind of pre-game for the big event. The company became more aggressive in pushing bad information off of the platform.
It even pushed out that Facebook group I joined, Stop Mandatory Vaccination, and its founder, Larry Cook. But interestingly, the reason they finally kicked him off wasn't for spreading anti-vaxxer misinformation. It was for spreading QAnon conspiracy theories. Turns out there's a lot of overlap between anti-vaxxer communities and QAnon communities. And Facebook gave Larry Cook a nice long heads up before kicking him off. So he actually spent his last few days on the platform pushing his audience of thousands and thousands of Facebook users to connect with his small misinformation empire off of Facebook. He does still have a YouTube channel with more than 50,000 subscribers and a website where you can really get a sense for the way he wraps vaccine misinformation into something that really feels more akin to like a lifestyle brand.
So another thing we recently checked was search results. You remember, this is what we were talking with Monica about a little bit, and this was part of Facebook's big policy changes that they were planning in 2019. A few weeks back, a long time after these efforts to ban misinformation from search were put into action, I logged onto Facebook and looked for information about vaccines with some pretty generic search terms like vaccines, vaccine information, things like that. And it took me less than 2 minutes to find this page. So it maybe looks innocuous enough at first blush, right? It's supposedly just making sure people log adverse reactions to COVID vaccines. But this kind of group and site, again and again, is proving to be kind of a gateway for much more aggressive anti-vax information, anti-vaxxer information, and misinformation campaigns, I should say. And top posts on this group are people from the group trying to game or avoid the Facebook algorithms, interestingly, by misspelling words and putting URLs onto the site, onto the page with spaces in between letters so that their cause isn't silenced, as one user put it. This commenter says, another commenter says here, "I'm not taking this vax and I'm not letting my child have it." So once again, you sort of see this connection to the parenting aspect of anti-vaxxer groups connected to the COVID vaccines.
Clearly, this challenge for Facebook is not over. Just last month, they took one of their biggest steps yet in curtailing the spread of this type of misinformation. Now, even if people are sharing those personal stories that Monica Becker was talking about, those posts meet the criteria for removal if they perpetuate unfounded conspiracy theories like vaccines cause autism. So in 2021, when taking a vaccine feels like a really existential crisis, right? Or when not taking a vaccine feels existential, right?
and just a really big choice, not just for yourself or your bubble or your community, but your country and maybe even the world. This is like a really big moment that we're talking around taking a vaccine to stop the pandemic. It feels more and more like an ethical or moral issue. So we hope that this was a thought-provoking kind of peek at a different ethical conversation that's happening online around information and the technology that we use increasingly, not just to educate ourselves, but more and more to actually get vaccinated. And we hope that you'll consider subscribing to Endless Thread, listen wherever you get your podcasts, and also listening to our infectious series, which you can find in its entirety at wbur.org/infectious.
And don't forget to upload your questions to slido.com to be answered by any of the people featured tonight. So without further ado, let's jump into another conversation about ethics and vaccines with WBUR's Deborah Becker and bioethicist Akilah Jefferson Shah. Take it away, guys.
All right. Well, thanks so much, Ben and Josh. Thanks for explaining some of that for us, and welcome everyone to this event. Thanks for joining us to talk about something that directly affects all of us. So we all want to say, yay, yay, the vaccines are here, but not everyone can get a shot right away. So our question tonight is, how are we prioritizing who goes first, and what sort of ethical questions does that raise? You know, every state has set up its own rollout for vaccine distribution. So we want to talk about how that's being handled and some of the issues involved, and how do we ensure that there's equity in vaccine distribution. And you know, I'm struck by a line that was written by one of our cognoscenti authors. How do we avoid writing another chapter in the book of privilege that we've seen throughout this pandemic? So to help us talk about this is Dr. Jefferson Shaw. Thanks so much for being with us tonight.
Thank you for having me. I'm happy to be here.
And we want to remind the audience, remind all of you that if you want to be part of this conversation, keep sending your questions at slido.com and use the event code vaccines. We'll try to get to as many of those as possible, and I'll ask them during the conversation. We'll also open it up to your questions at the end of this. So, Dr. Jefferson Shaw, vaccine distribution and risking becoming another chapter in the book of privilege. I'm wondering, you know, in all fairness, this effort to vaccinate every single person certainly is an enormous undertaking. But generally, what do you think equity means here in this effort? Millions of people needing this. How do we, or should we, decide who goes first?
It's a great question. And really, from an ethical standpoint, when I think of equity, I think of fairness and justice, right? So we want to make sure that people are not only getting vaccinated, but they're getting vaccinated and not leaving someone else behind. That everyone has an equal opportunity in some way, shape, or form to get this vaccine that we believe is the path out of the pandemic. And we believe is a path to make sure more people do not get sick, have morbidity related to the disease, to COVID-19, and also mortality related to COVID-19. Generally speaking, in order to do this equitably, we have to, of course, think of different populations who have been impacted differently by the pandemic and by COVID-19. And so when you think about that from an ethical standpoint, we have to prioritize certain groups over others. We have to figure out the best way to do that and how to do that in the most fair and just way possible.
Right. So who would you choose, if you could, in terms of groups that need to be prioritized right away? Say the top 3 groups. Who would they be?
I would choose the people, number one, who have been most impacted. So we could say first, older people would be that, right? We know that the elderly have been disproportionately impacted, particularly ones who live in long-term care facilities and other kind of communal living situations. Another group that I think would be high up there are people who have high risk of exposure to COVID-19 or to SARS-CoV-2, the virus that causes COVID-19, which is one of the main reasons why healthcare workers frontline workers, essential workers are at the top of the list in a lot of places. And then number 3, I would think about other groups that have been disproportionately impacted, such as Black and Brown communities, the people who are currently incarcerated, the homeless, people who are less often thought about in these big prioritization platforms.
Now, in Massachusetts, we've pretty much followed a lot of that. We've put folks who are incarcerated, folks living in homeless shelters, the elderly, healthcare workers, all in the first phase of our rollout. But I want to talk about first some specific examples of ethical questions, and then maybe we'll get into a little policy. So there are some folks that we've heard from who say that their employer, perhaps a healthcare provider, is offering a vaccine, but they're not technically eligible. They're not older. They don't have pre-existing health conditions. So if your employer offers you the vaccine, do you take it or do you not take it if you don't have other health issues and you're not in a high-risk population? Would it necessarily go to someone who may be in a higher risk population, or would it just go to the next employee on the list who may accept? And if you do take it, aren't you contributing to herd immunity? So should everybody try to take it once their particular pod gets the vaccine? What would you say to that?
So I would say it depends. So definitely, if you are working in a particular place where, let's say you're at high risk of exposure to COVID-19, no matter if you have underlying comorbidities or you're older, but you have high exposure to or potential exposures to the virus, that may be a reason for you to take the vaccine. Just as, we consider people who work in high risk positions such as grocery stores or people who work in sanitation or any of those things where you may not have the underlying comorbid stuff or the older age, but you're still at some sort of higher risk than the general population. So I would take it there. But if you're talking about a young, healthy person who does not have any exposures, any risk factors whatsoever with their job, should they be front in line, the first in line? I think the answer to that, for me at least, would be a no. And perhaps you should let other people who are higher risk go first. But these are the complicated questions, right, that we want to answer, and they're very case specific and a lot of times. And so you can't have just kind of one overarching answer for all the scenarios.
Right. So we don't, it isn't though necessarily, depending on where you are, that if you do say, using a complete hypothetical here, I work in a hospital, I'm in an administrative job, I'm working from home, but I can get the vaccine because my hospital is distributing it. I don't feel like I should take it. But if I don't, is someone more deserving necessarily going to get it? I think that's the big question. And I don't know that we know the answer to that, right?
I agree. It's hard to say who's going to get it next, who's going to be next in line. But I do think that you can ask, right? So I think you can ask if you feel like maybe I should not get it yet. Maybe it should not be my turn. But you can ask your administrators, you can ask your boss, you can ask the hospital administration, who is next in line here to get it? Is it going to be that they're going to give it to people who are older, have comorbidities, or who are in more direct contact with potential exposure to the virus? In that case, you may want to say, okay, maybe I shouldn't get it right now and wait. A lot of times it's going to be hard to know for sure who's going to be next in line. But, I think it comes down to each and every person. If you think, number one, if you're staying at home and you can stay at home for a long time, there is going to be someone else who is at a higher risk than you, for sure. And most likely somebody that you work with who's going to be at higher risk than you. And so it's not going to be unreasonable for you to wait a little bit. But the other thing I would say, the other consideration really is we're talking about individual risk, but we're also talking about community-wide risk, right? And so if we're thinking of specific communities who may be at higher risk and you happen to live in that community or be a member of that community, even if you think your individual risk is a little bit lower, it is probably reasonable also for you to go a little bit earlier in the line to keep your other community members safe.
Now, one interesting thing that came up is Moderna, the vaccine maker that's based here in Massachusetts, did offer vaccines right off the bat to its board members, its employees, and family members of employees. And the company said it needs to keep workforce operations, full steam ahead. They're making the vaccine. They can't have a family member of a key worker getting sick and people having to quarantine. So they needed to include everyone as soon as possible. Ethical?
I'll say I don't agree with that interpretation. So, in the same way, I work in a hospital and I work in a clinic, right? Just because I'm a frontline healthcare worker does not mean that everyone in my household is at the same risk level that I'm at, right? So, one of the reasons why healthcare workers were put early in the line is because of that risk there. But their family members or people who live in house with them were not put first in line because their risk is actually much lower. Theoretically, one could say that people who live in the house with someone else who's at a high risk perhaps could be exposed to, but that's really, you have to do a lot of mental gymnastics to make that make any kind of good sense to me. So I think, really we should stick to the true risk level that people have and not try to extrapolate that to fit who we want to get vaccinated when it is a good thing for us. So I'll leave it at that.
So easy to justify, though. It's just it's just so easy. What about, though, there's been a lot of debate about teachers and school staff. And you work primarily in pediatrics. So, this is a tough issue. And everybody wants the schools to open, but how do we do it safely? And an audience member, has asked about this. Why aren't teachers being included in the first phase in most states? What do you think about that notion about teachers and school staff so kids can get back to school?
All right. So I think teachers need to get vaccinated. And, it's one of those things where, again, if we're thinking about individual risk, there are lots of teachers individually who are higher risk due to their age, comorbid status, et cetera. But then also, if we think about wanting to get our communities at a more healthy place, a less vulnerable place, that does start with making sure we have big swaths of the community, such as school places, that are better protected. So teachers, they're a key to getting schools open safely together in a communal space to keep our kids, kind of going, since they cannot themselves get vaccinated at this point, most kids, if you're not 16 years or younger. And so, teachers are going to be the gateway to kind of make that happen. We don't want to put teachers at higher risk by putting them all together, right? They're all from different households. They're all doing different separate things. And so if we put people together in a space where they can't socially distance, they can't do everything else that they need to do to keep safe, the one thing that we can do to keep them safe is to vaccinate them. And so that would be another reason why you want to do it, I think, in that instance. As to why individual states haven't decided that's a priority, there are probably many reasons for that. But generally speaking, I think everyone wants schools to be open. We know that's going to be better for children in general. And one of the safest ways to do that is to make sure the community around the kids are as well protected as possible through vaccination.
So teachers should be in phase 1, you would say?
I think they should be. I don't know which phase number we're going to talk about, but I think they should be at least in a high phase,
Yeah.
somewhere close to where healthcare workers are, somewhere near that frontline workers, essential workers. They should be up there, I think, with that and not in the lower phases, whatever the number is.
Yeah, depending on the state. Most states are using the honor system here. When you're talking about comorbidities and other issues that would make someone eligible for the vaccine. And in Massachusetts, there was some controversy that you may have heard of where we had companion vaccines, where if someone took a senior to get a vaccination, they could be eligible for getting vaccinated. And of course, that prompted ads on Craigslist and folks offering to give people rides or do what they could to help so they could then get vaccinated if they helped a senior get a vaccination. So I guess I wonder, with the honor system involved here, does it work in this kind of situation where everyone is vying for something and there's just not enough right now? And is there a better way? Is there a better way to do it?
I don't think it works. And we know that people who are not eligible via the criteria that's been, given for each state are getting vaccinated. And they're getting vaccinated because they say that they're a teacher or they're a healthcare worker or that they have diabetes or whatever it is to fit the criteria. And it's not true. So we know that it doesn't work. We know that there are people who are going to cheat the system in a certain way. The other thing we know is that the honor system doesn't work for everyone, generally speaking. So it depends on how you look, right? So, if you go to a place and someone doesn't like the way that you look for whatever reason, whether it's the color of your skin or it's something else that has to do with you, they're going to ask you questions. And so the honor system gets thrown out of the window in that situation, versus if you're a more privileged person, you may not have to answer any of those questions at all. And you just kind of can get whatever it is that you asked for. So, there are many ways in which the honor system is not going to be the best way to ensure an equitable vaccine distribution system, or one that is even doing the best to not waste our resources, or to be smart about our resources. And so we have to come up with better ways to do it, whether it is literally that you have to have documentation stating your age, for instance, which is easy enough to do, your job, your occupation, your underlying health status, or whatever it is, where you live, whatever the criteria is, we might have to do that, because we know the honor system doesn't work for everyone.
Right. So you would support that. You would support some more documentation to make sure that people actually are eligible to get the vaccine if they say they are.
I would.
There was a story on NPR this morning about a congressional investigation into a concierge medical provider offering the vaccine apparently to people who were well connected to this provider. Now, as we've said, the honor system, we've heard, doesn't necessarily work, and the system that we have in place right now is probably really open to these kinds of abuses. How much of a problem do you think this is, that because the vaccine is so valuable, that a lot of it is being distributed right now to people who have influence and connections?
I think it is a problem. And, I would argue to say that I would personally know of people who have gotten the vaccine based on, criteria that shouldn't really be there. They know so-and-so, they know who to call, whatever it is. And I would argue that a lot of people know people who've gotten the vaccine this way. So it's not necessarily privilege in a kind of a money, sense. It's also privilege in a who do you know kind of a sense. And so who do you know who knows someone who has a connection at the Department of Health, or has a connection with whatever the clinic is that happened to get X amount of doses today, to be able to get your vaccine. And so, these are all issues that are going on across the country. And there are some that make the headlines, such as the one that you mentioned. There have been some in Philadelphia that made big headlines in the past few weeks. There have been some in Texas that have made headlines. It's happening all over the place. And, with any scarce resource that is life-saving, possibly, people are going to do things that are questionable and that are unethical. And so we have to come up with systems to really combat that as much as possible.
Now, you mentioned folks who are incarcerated and folks who are homeless, vulnerable populations receiving the vaccine early on. And in Massachusetts, we've done that. We're doing it still. We've offered the vaccine to prisoners and to folks in congregate care settings like group homes and homeless shelters. But that's prompted a lot of debate among some who say, why is this group more eligible than grocery store workers or teachers or
Sorry, Deb, I lost some of your audio.
why? Oh, sorry. Can you hear me now?
Yes.
Why prioritize folks in congregate care settings? Why is that important?
So, number one, when we're thinking about fairness, just because you happen to be incarcerated or just because you happen to be homeless does not mean that your life is any less valuable than anybody else. And so I think a lot of the judgments made when people talk about these different populations start from a place where those lives are not considered as valuable as other lives, people who have a home, people who are not incarcerated. So that would be the first place where I stop and say we have to check that, or, kind of look at our bias there. The second thing really is that we know that these populations, particularly those who are incarcerated, have been very hard hit by COVID-19, have died at horribly disproportionate rates, and are at very high risk due to the situations in which they live. And so if we're serious about making sure we are giving people the vaccine who are high risk first, which I think we should be, then those populations have to be at the top of the list. Now, if it's going to be before frontline workers, right after frontline workers, I think that can be up for debate, and that different people will have different opinions about it. But at least we have to say that those groups will be at the top of the list, somewhere close to either right above, right below other groups that we talk about as being important in the beginning.
I have a question from the audience here. Smoking is considered an issue that puts someone at risk for COVID. So this question is, how is it ethical to permit a younger person who smokes to get the vaccine before me and others with chronic illnesses like type 1 diabetes? What
Right.
would you say to that audience member about that question?
I think, we're thinking about risk in not just a singular fashion. So if you're an older person who also has a chronic lung disease or an underlying health condition, that's technically going to put you at a higher risk than a young person who smokes, most likely. And so still, you should be prioritized, in my opinion, higher than the young person who smokes. I think the heart of that question really is sort of how do lifestyle choices and choices that people make, is that something that we should be considering here? At that, if it's something we would consider a bad choice, should that allow them to then kind of reap the benefits of whatever it is? And I would say sometimes it can, because so many things happen in life, right? And so many reasons why people, for instance, smoke that, are really outside of themselves. They grew up in a household where everyone smoked, and then, they smoke too, kind of a thing. It's not necessarily always a personal, individual blame that you can place on those things. And I think we get into a very slippery slope if we start to do the blame game a whole lot in those situations, as far as behaviors, comorbid conditions that people have and why they have those things, because it's almost never just an individual decision that led people down a certain path. And so we have to take all that into account.
One thing that you mentioned in the beginning, and one thing that's specific to Massachusetts in policy, is trying to get the vaccine not only distributed but accepted in communities that have been hard hit by COVID-19. So the state has identified 20 communities that have been particularly hard hit, and is promising that extra public health resources will be used in those communities for a variety of programs to improve the rate of vaccination. Is that a good way to make sure that those communities get the vaccine and accept the vaccine? And is that a way to improve trust? Or what would you suggest that states do to ensure that there's equity in Black and Brown communities?
I think that you have to go to those communities and figure out why there's not good vaccine uptake. And there is an issue with vaccine hesitancy for sure, right? Particularly among the Black community and many different places throughout the United States. And I want to be sure not to label the Black community as one big monolithic community, because it's not. And there are different considerations that people, let's say in the South where I am in Little Rock, have versus where you are in Massachusetts, right? So we have to be cognizant of what's happening on the ground in those particular places. And so one way to do that is to actually have people on the ground, right? And to partner with these communities to figure out what the particular issue is, whether it is that there's not been enough education provided about vaccines in general, or the COVID-19 vaccine specifically, or there's some other issue there, and really address that. So I do think that one way you can do that is to really put your money where your mouth is from a state and local standpoint, to make sure places have resources to provide whatever it is that is really the barrier to getting people vaccinated. I'll say in some other places, it's not just about hesitancy, it's also about access to vaccination sites. And so if we make sure we put money into getting accessible places for people to get vaccines in the community, so if it's someplace that you can walk to, everyone may not have a car, or someplace that's nearby, a trusted place where hey, it's at Bob's barber shop or whatever it is, to get your vaccine there. That's going to make things a whole lot easier than if you have to go across town to a place that you don't know, that's far away, that may cost you money to get there that you don't have. And so we have to think about all these things, but every community is going to be unique in what they need. And the only way we figure that out is to stop kind of labeling as a big monolithic vaccine hesitancy issue and really getting feet on the ground to figure out what the problems are, or what the barriers are. I shouldn't say problems, what the barriers are in those particular places.
Mm-hmm. I just want to say in a few minutes, we're going to open it up to audience questions. So if you do have questions and you're listening right now, you can send them to us at slido.com and use the event code vaccines. And we will try to get to as many of those as possible. We have some now, but I have just a few more questions that I would like to ask you, Dr. Jefferson Shaw. One is about refusing the vaccine. There are people who, there's a great deal of vaccine hesitancy for a variety of reasons. And if we just look at, say, the incarcerated population, because we have numbers there of how many people have refused the vaccine, right now it's about a third of those incarcerated who are not taking the vaccine, and almost half of correctional staff are not accepting the vaccine. And that's for, based on what we can tell, the reasons we don't know as well as the numbers, but it seems to be a lot of concern about the speed with which the vaccine was approved, the fact that it's only approved for emergency use, and sometimes mistrust of the healthcare providers in correctional settings, right? So there's a bunch of different reasons there, but what if someone refuses? Should they be allowed to, when you have something like COVID that can be spread throughout the community? And how do you deal with that?
I think, people always have to be able to make their own choices, right? But the important part, I think, is making an informed choice. And right now, as earlier when we had the podcast playing, those informed choices are really being hindered by misinformation. And so, number one, so if we break down the speed at which the vaccines were made, and we can talk about the mRNA vaccines specifically, there's a lot of misinformation about that. So these vaccines, the technology has been studied for 30 plus years here in the United States and elsewhere to figure out how to use this vaccine technology to then make this type of COVID-19 vaccine. And so it's not that last year, in January 2020, all of a sudden someone thought up this idea to make an mRNA vaccine and then produced it or whatever. So, really educating people and giving them information about how the vaccines were actually produced, how they were tested in preclinical phases and phase 1 trials, and then on to phase 2 and phase 3 trials. I think, if we can give people the information and then they make an informed choice, right? We have to respect their choices, but at least we have to give them the capacity to make an informed decision about it. I think at present, many of the decisions that are being made about with regard to vaccine refusal are not the best informed decisions. They're based on misinformation from social media or from a friend or from a family member, or whatever it is. And so really it is our job, I would say, as a doctor, as scientists, as people in media, to really put out good information out there so people can make better choices. Hopefully it'll be one that's in line with what I want them to do, but sometimes it won't be. And, we have to deal with that too. Hopefully not as much as we're dealing with it right now.
Employers are not requiring these vaccines right now. They are not supposed to be mandated because they're only approved for emergency use. Although, it may be tested in court at some point, clearly. But do you think, you've said that you feel that there should be adequate information and people's choices should be respected here, but should some employers be allowed to mandate vaccines? What do you think?
I think so. I think, when we're putting other people at very high risk, so I would say I'm a doctor. I think most doctors should be getting vaccinated. And that is most, and I'll say most doctors who see patients, right? They're not all doctors who see patients. Most healthcare providers who physically see patients face to face all the time. I think there's an argument there that those people really have to get vaccinated, and that we can't have large swaths of populations that are frontline workers or in major contact with the public who are just outright refusing to get vaccinated. Legally, how that works, I'm not a lawyer, so I don't know how that's going to hold up in court. But I think ethically, I think of do no harm, right? As a physician. And one of the ways to do no harm, I get a flu shot every year. It is mandated. I have to keep up with other vaccinations, and that's not just to keep me safe, it's so that I do not get my patients safe. And so we have to think about COVID-19 in the same way.
Okay, we're going to take some audience questions. Reminder, slido.com. The event code is vaccines. Here's a question. What is the best way to earn the trust of skeptical communities and address their concerns to get them to take the vaccine?
I think meeting people where they are is number one. So I don't know if you all have ever tried to just argue outright with someone who you disagree with. And it usually doesn't go well without trying to listen to why they think what they think. And so that's really the first thing, asking people, what is the issue here? What is it that you're thinking? What information is it that you have or you don't have? And then let's kind of fill in the gaps and try to come at it from that angle. I'll give an anecdote. I have a cousin who is a frontline worker who did not want to get the vaccine. I called him. I said, why? I didn't say, I disagree with you. You better get this thing. I said, hey, why? What's the problem? Why don't you want to get it? What is your concern? And he told me. We had a conversation about it. And then about 2 weeks later, he got the vaccine after we talked about it. So I think a lot of times, literally, if you just meet people where they are, figure out what the concern is, and try to get at that concern, then you can really make headway versus trying to just put your ideas and your belief onto someone without adequately listening to whatever their issue is.
Is it dangerous to gather in large groups to vaccinate, given how COVID spreads? Many states, including Massachusetts, have these big, we're using stadiums, right, to vaccinate, ballparks to vaccinate people. Is that safe?
If we're doing it with proper social distancing, mask wearing, sanitizing, it can be safe. The other thing we know is if you do things outdoors versus indoors, you really increase the safety level there. And I think in lots of places, particularly large stadiums, there are outdoor situations, or having people stay in their cars, for instance, is another way to keep things safe. So I would say generally, yes, that is a safe thing to do.
Okay. Another question. Do you think vaccine appointments being made almost entirely online are going to deter or prevent people from signing up?
I think, so I don't know if I would say deter, but I would say prevent, definitely. So we think there are lots of people who are not well connected to the internet, generally speaking, who don't have internet service, who may not have smartphones, who may not have computers. And so that is a huge barrier into getting people online to just make those appointments. The other thing is a lot of people are not computer savvy or internet savvy. And so literally, if they do have a computer, being able to use it effectively to get appointments made is going to be very difficult for large groups of people, whether it is the elderly, whether it's people who are in underserved communities, whether it's people who live in rural places, which here where I am, we have a large, most of our, I would say almost half of our state is rural. And so you have to think about all those things as far as barriers to access to getting vaccine appointments.
I've heard, this is another question. I've heard that other countries are requiring things such as vaccine passports to enter certain buildings or to travel. Do you think that that could happen here, and is it a good idea?
I think it could definitely happen here. Is it a good idea? That's, I think, up for debate a little bit. So it really depends on what the situation is. Is it that we need a vaccine passport to get on an airplane to fly to another place? I think arguably some people could argue that that is a good idea because we don't want to bring COVID from, let's say, Massachusetts all the way down here to Arkansas or whatever it is, or to another country. We get into it, I think, and the other thing I'll say there is you're not on an airplane by yourself, right? You're going to be in contact with hundreds of people, most likely on an airplane. It's a bit different, or could be considered different if you are doing things where it's really kind of one-on-one, or you just contact one or two other people, where maybe that argument wouldn't hold up so well. But I think if you are possibly putting large groups of people at risk, then a vaccine passport may be appropriate in those situations.
Another question. Our audience has great questions, I want to say, by the way. They're really coming at us. When is the right time to open up businesses, or presumably to, lift some restrictions in relation to how many people have been vaccinated?
That is a great question, and I don't have a great answer for it. I wish I did. So I think, we have to think about all these things. Number one, our cases coming down. So not just people vaccinated, our case rates coming down, case positivity rates coming down, all hospitalizations coming down, deaths coming down at an appropriate level. And every place, is going to have a different threshold for that. But we have to think about that in addition to how many people are vaccinated. The numbers looking at how many people are needed for herd immunity kind of vary. We don't know what that number is necessarily. We have models that think maybe it's 60, 70, 80% of the population, but we really don't have any 100% idea about how that's going to work. And we're not going to know that until we really look at how the cases are longitudinally after people get vaccinated. So in general, I know a lot of places are trying to lift restrictions like now. That seems very premature, right? Case rates are coming down, but we don't know longitudinally how that's going to look. And so we need, I think, a bit more data, a bit more time to see how cases are going to go as we get more people vaccinated, that it's closer to those kind of thresholds that we think we need for herd immunity, 60, 70, 80% of the population.
Right. Massachusetts, as of yesterday, started easing some restrictions. Texas lifted its mask mandate today. Too early, would you say?
I think so. That, every public health official is saying continue to wear masks, continue to think about how we're reopening and not do things too quickly. And so, I'll stick with masks in particular. We know that masks can really decrease the aerosols, the droplets that spread COVID-19. And we don't have nearly enough people vaccinated anywhere. We still have cases that are through the roof, though they're coming down in most places across the US. And so it's way too soon to tell people not to wear a mask anymore if they're in public.
Another audience question: what ethically can more affluent countries be doing right now to help those in less wealthy countries have some degree of access to vaccines?
I think, again, earlier I said kind of putting your money where your mouth is. It's the same sort of a thing. We have to have a monetary commitment, not just words, to making sure vaccines are available to other countries that are not as well off in some ways as the US. And really, we can't just say that. We have to do it, right? We have to make sure that orders are physically in for these vaccines. And then secondarily, come up with a plan to make sure the actual vaccines make it to the place that we want it to go. So, there are many steps that are required there, but it is not just a quote unquote commitment. It has to actually be action behind that commitment and that intention.
We only have time for maybe one or two more questions. So I'll try to prioritize here. Here's another one. How do we prevent the misinformation that we heard about at the start of the program and other forms of information from spreading while addressing, some people's legitimate concerns about the vaccines? What do you suggest that folks do? You talked about the conversation you had with your cousin, but it's tough to have one-on-one conversations with everyone who may be hesitant. So what's the best way forward there?
I think, we have right now pretty central places where you can find good information. You can go to the CDC's website, you can go to the FDA's website, you can go to the World Health Organization's website for good, solid, information on vaccines, on COVID-19, on many other health topics. So number one, we have to stick to the science and the data and the sources and make sure, whether it's a one-on-one conversation or when you're emailing or posting or whatever it is, it takes every single person to intentionally put out good information and to intentionally stop spreading bad information. So I'll say I like to tell stories about my cousins and family members. A cousin who sent me a video on one of the social media sites, and it was clearly, to me, bad misinformation. It was completely false. It was terrible. And her comment was, "Hey, I just wanted to double check if this is real before I share it with people." And I said, "No, it's not real. Stop sharing." And, she didn't share in that instance. But a lot of times I think even if we know that it's fake, people still share, right?
Right.
And we have to stop that. We have to just say, "Hey, we're not going to put this garbage, trash out anymore," and just stop sharing it, especially if you know better than to do that. So I think individually we all have to make that decision to do it. And hopefully that decreases the amount of bad information, misinformation that is out there, so that there's less of that spread around.
Who do you think is doing it closest to right? Who's distributing vaccines, would you say, or what policy do you find that's working most effectively in a state right now in terms of getting close to the idea of equity in distribution?
There are a lot of places that are getting it right. I'll talk about my home state for a second. I'm from Louisiana, from New Orleans, Louisiana. And there was a vaccine clinic, a community clinic that was done back on Martin Luther King Day in the suburbs, basically, of New Orleans, in a predominantly Black community. It was organized by predominantly Black folks, including the city council member and others. And what they did is they talked to those people who lived there, made sure it was a place that people could easily get to, right? If you need to walk there, if you need to get a ride there. They advertised it so that people who needed to know, who may not be on Facebook or Twitter or whatever, knew about it. They had phone calls going out. They had, notifications at the churches going out, all this stuff to make sure the people that they were targeting for this particular clinic, which were highly vulnerable populations, knew about what was going on, and they were hearing it from their peers. And so I think that is a good way to do it, right? We can't just have random people come into communities and tell them what to do. We have to partner with communities, figure out what the need is there, what the barriers are there, and then really shape our policies, our approaches to vaccination based on that information. And so that drive, I'll say that vaccine drive, I was so happy about it, to hear about it, because they got 1,000 people vaccinated in a day back in January in a community that was very hard hit by COVID-19, and they did it by partnering with the people there.
Yeah. All right. Well, unfortunately, we are out of time, but I want to thank you so much for being with us. This has been a great conversation, so thank you.
Thank you for having me.
Dr. Akilah Jefferson Shah is an assistant professor of allergy and immunology and a bioethicist at the University of Arkansas, and it's been terrific. I also want to thank Ben Brock Johnson and Josh Swartz of WBUR's Endless Thread podcast. So subscribe. It's a terrific podcast. And thanks to everyone in the audience for your great questions and for joining us tonight. And just a reminder, a week from today, on Tuesday, March 9th at 6 p.m., again, we will host the final event in the WBUR Town Hall series on the COVID vaccine. Ben Brock Johnson will be back again next week, and with Common Health reporter Angus Chen, and they will be in conversation with Dr. Charles Anderson. He's president and CEO of the Dimick Center, and Dr. Sabrina Asamu, who's Boston University School of Medicine assistant professor and infectious disease physician at Boston Medical Center. And they will be answering your questions and, again, be talking about misinformation about the COVID vaccine. So you can register for that event 1 week from tonight and find out more at wbur.org/cityspace. Again, thanks for being with us. Good night.